morning and welcome to GBN Live. I'm your host, Tracy Hansen. I'm with the Saybrook chapter of GBN. Please join me today in welcoming Mike Jones. Mike is with Grand Anchor Insurance, and I'm looking forward to hearing all about Grand Anchor Insurance and all that you do. Welcome, Mike. Thanks for joining us today.
Thank you.
Before we get started, too, I just want to point out that if you are having trouble with your comments in showing up, you have to go to streamyard.com/Facebook, and then that will grant us permission to show your comments on air. And I'd also like to thank our sponsor, Grand Strand Law Group, for sponsoring our show. Their info is on the right, and you can also reach them at 843-492-5422. They want to be your trusted choice. You can also reach them at grandstrandlawgroup.com, and they have offices in Myrtle Beach and North Myrtle Beach, and they're ready to help you with all your real estate needs, trusts and wills, probate, things like that. So definitely give them a call if you need them. Okay, so stick around, and we will be right back with Mike and GBN Live. All right, so welcome back. Here with us today is Mike Jones with Grand Anchor Insurance. Welcome, Mike.
Thank you, Tracy.
We're so happy you could join us. Before we get started, though, on talking about insurance, let's talk a little bit about you. Tell us a little bit about yourself, where you're originally from, your family, that kind of thing.
So I'm originally from Fayetteville, North Carolina. I'm married to a beautiful wife named Mary, and we have 3 children. An 8-year-old daughter, a 3-year-old daughter, and a 7-month-old son.
Oh, wow.
Yeah.
7. So you got a busy house going on. Huh?
Oh, crazy busy. It's especially with 2 of them not being potty trained. We've
oh man,
we've got our hands full. So but we've been down here about 6 years in the Myrtle Beach area, and we absolutely love it.
That's great. That's awesome. Yeah, we love it too. Where did you say you were originally from then?
In the, Fayetteville, North Carolina.
Gotcha. So not too far away.
No.
So you still have a lot of family in the area.
Oh, of course. Yeah, my dad's up in Little River. My sister's in Wilmington. We're real close.
Yeah, very good. Very good. So how long have you been in the insurance business, and what got you interested in health insurance?
So I've been doing it for about 2 years now. And I would say with health insurance, it's something I feel like everybody needs. And, a lot of people don't really understand it quite. But, at the end of the day with health insurance, I definitely feel like I've helped somebody, and my job's very rewarding. So that's what got me interested in health insurance.
Oh, cool. Well, what kind of things, if somebody's looking for health insurance, what kind of things should a consumer look for?
First, I always like to start with the 2 Ds, their doctors and their drugs. So you should definitely make sure that your doctors are going to be in network with whatever plan you want, whatever plan you're looking at, as well as you want to make sure that plan is going to cover your medications. Some people don't take any, but some people have a lengthy list of medications. So you definitely want to make sure that plan is going to cover your medications well and doesn't cost you a lot of money there.
Right. So as an independent agent, I assume then you shop around for several different companies that you work with.
Absolutely.
Can you explain how that works a little bit for the consumer?
Yes. So, there's multiple different companies in the South Carolina area, and I'm contracted with all the major ones here in Horry County. And, with all the different companies, each one has multiple different plans. So for the average consumer, when you get online and start taking a look at these things, it can get very confusing, which is, one good reason to use an agent to kind of help you understand what all the different plans and different companies have to offer.
Right. So, where would a consumer go to start looking at healthcare, or where would they need to enroll?
So you can enroll individually on the health insurance marketplace, or Medicare for seniors on Medicare.gov. So that's, if you wanted to go about doing it yourself, you could do it that way. Or, if you just search for local health insurance agent near me, it's always good to, use somebody independent that can shop all the carriers for you.
Mm-hmm.
But that's it. And then and there's no charge. What I like is there's no charge to using our service. So, a lot of times I'll be sitting down with a couple at their dining room table and help them find a plan. And when we get done, they're like, "Oh, Mike, that was great. How much do I owe you?" Best part about my job is you don't owe me anything. The insurance company will make sure they take care of me. And, at the end of the day, I feel like I did somebody a good service.
That's great. So if you have any questions or comments for Mike, please type them in the comments section, and we will be sure to get to them. So back to the health insurance. How does one go about determining how much they're going to need, or you can't predict the future. So, how do you kind of make sure you're covered without?
Absolutely. So, anybody that does have pre-existing conditions, of course, they might know how many times a year they're going to their primary doctor, how many times a year they see a specialist, what medicines they're on. Those are good factors in determining how much that person would need. But let's say you're, completely healthy, then we'll just cover, hey, this top of the line plan here will cover you in all these situations. And then this plan, if you're in good health, maybe this, more affordable plan is more right for you. So we look at family history as well, genetics and, what you may be looking to anticipate there.
Gotcha. All right. Well, we are going to take a quick commercial break here. So stick with us and we will be right back with GBN Live.
Hi, I'm Justice Ann. I've been a canine liaison at Grand Strand Law Group for, 30 years? What's that? You don't believe me? I meant 30 dog years, of course. First rule of lawyering, read the fine print. Anywho, my humans at Grand Strand Law Group have a combined 20 years experience. I know, not as much as me, but that's in people years. So yeah, still pretty impressive. Real estate, estate planning, or probate, you need GSLG.
Grand Strand Law Group. Trust us, we have a dog.
Great Business Networking grew out of the idea that by creating lasting friendships within the community, we can make the community even better.
I was looking to network with professionals and to be able to refer my clients to somebody that I trust.
Well, it's really important to trust the members of the group because we really generate quality referrals, and to know somebody, be friends with them, and get that qualified referral is the key to success.
It is networking, but it doesn't feel like networking, and that is important to me. I come to the meetings, I have fun, I make great connections, and I help grow my business.
GBN, these are some of the best professionals in the market, and having that resource available to me, that's priceless.
Well, GBN is a network of business professionals that build long-lasting friendships that will not only grow my business, will grow yours as well. That's what referral marketing is all about.
GBN really is the most important marketing for your business. Check us out today.
Welcome back to GBN Live. I am your host, Tracy Hansen, and I'm here with Mike Jones with Grand Anchor Insurance. I'd also like to take a quick moment again to thank our sponsors, Grand Strand Law Group. You can reach them at www.grandstrandlawgroup.com. They have offices in Myrtle Beach and North Myrtle Beach, and they are ready to help you with all your real estate needs, wills, trusts, things like that. Their number is 843-492-5422. And again, that's Grand Strand Law Group. And if you have any questions or comments, please type them in. If you're having trouble with that, with your comments showing up, you can go to StreamYard.com/Facebook, and that will grant us permission to show your comments. Okay, so we're back here with Mike, and we're talking about health insurance. And I'd like to know, Mike, can you explain a little bit about deductibles? And I've heard about combined deductibles. I'm not quite sure about that, but kind of just like how people should kind of keep a lookout for deductibles, because that really makes a big difference.
It does. That's definitely something to take into consideration when you're choosing your health plan. So basically, in a nutshell, what a deductible is if you had to go inpatient to the hospital, you have to meet that deductible before your health plan is going to kick in. Okay. So, average out there, we see a lot of $2,000-$3,000 deductibles. They can go all the way up to $7,000 for an individual, or $14,000-$15,000 for a family.
Wow.
And yeah, that's a lot of out-of-pocket costs, to go inpatient to the hospital. Now, a combined deductible is typically there's a health deductible for those hospital visits, but there's also a drug deductible. So if you're on any brand name medication, you have to pay whatever that drug deductible is before you'll have a copay to pick up that prescription. So a combined will take that medical deductible and the drug deductible and kind of put it together into one, so you don't really have to worry about, have I met this, have I met that.
Right. And then, so what would you say is an average deductible? If somebody sees a deductible and it's $2,000, $3,000, you'd say that's pretty average.
Yep,
so
pretty
not
average.
to worry about something like that.
Absolutely.
Okay. So I also hear a lot about co-pays and co-insurance,
Yes.
and that kind of thing as well. So if you can explain a little bit about how that works.
Yeah. So a copay is going to be when you do go to your primary doctor or your specialist. Primaries typically, a lot of times the primary will have a $0 copay. Could be 20, 30, 40, depending on what plan you have. And then your specialist is a little bit higher. So specialist is, anywhere in the $50 to $90 range to see a specialist copay. And then co-insurance, that we get that question a lot. So what co-insurance is on your plan there, you'll see 15, 20, 25% co-insurance. And what that is that's the portion of that bill that you'll pay and your insurance will pay the rest. So let's say you have a 25/75 co-insurance. That means you're going to pay 25% of that hospital bill, typically once you've met your deductible, and your insurance company will pay the other 75% of that deductible, or excuse me, that hospital bill. And
Gotcha.
that's your co-insurance.
And you have to meet your deductible prior to.
Correct.
Oh, okay. Okay. Gotcha. We do have a question from the internet here, from Facebook. What are the dates of open enrollment?
Oh, great question. So for Medicare, and for anybody that doesn't know, Medicare is for anybody 65 years and older, or anybody under the age of 65 that has certain disabilities. For Medicare, the open enrollment periods is October 15th through December the 7th. And then for the Affordable Care Act or the marketplace insurance for anybody under 65, it's from November 1st to January 15th.
Okay, so that just kicked in.
Yes, it did.
Yes.
It started yesterday.
Yes, so we got to get on that.
Yes.
So you touched a little bit about prescription medications and that kind of thing, and how they're covered. So can you talk a little bit more about that? Those can really run someone some money.
Yeah, most likely. And of course, so, you've got different levels of health plans, and the more affordable plans are probably going to have a bit of a higher copay on your medicines. Whereas if you're paying more for that health insurance plan, you might have a lower copay to pick up those prescriptions. And then prescriptions also, they come in tiers. So your tier 1 is going to be your generics, and those are going to be lower copays. But then you goes all the way up to brand names and preferred brand names. So when you get into those specialty name brand medications, they can get pretty expensive. And I always recommend my clients, yes, you're going to have a copay with your health plan to pick up that prescription, but always look at GoodRx, because you have the option. Just because you have health insurance, sometimes GoodRx will come out cheaper than what your health insurance is. So there's an app on your phone. If you've got a smartphone, download the GoodRx app, put in whatever the name of your prescription is. You can check before you go to that pharmacy, is my copay with my health plan going to be cheaper, or is GoodRx going to be cheaper, so that when you go, you'll know which one's going to save you the most money.
Right. That's good advice too with those discount prescription
Oh, yeah.
cards. We actually, as GBN, we have a discount prescription card available to us as well
Oh,
for
that's
GBN
great.
members. Yep. So it's called Clever RX.
Gotcha. Yep,
So
I've
we
seen
use that, and a lot of our members have saved a lot of money. So I definitely recommend, even if it's not that, like you said, the Good RX are definitely worth it for sure. What we do now is we have a few rapid fire questions to ask you. These are just fun, no pressure questions, just about you basically, and just give us your answer right off the top of your head.
Sure.
So, what was your first job?
Oh man, Kyoto Express.
Oh yeah.
Yep, it's like a little fast food hibachi kind of place.
Okay.
Yep.
All right. So now, were you in the kitchen in there?
No,
or
they
were
did
you
not
doing?
allow me in the kitchen. No sharp knives at that age.
Right. How old were you?
Let's see, 15.
Oh, okay.
Yeah.
Good time to start a job.
Oh yeah.
Yeah, I have a 14-year-old. She's looking to start a job, so
Nice.
I think at that age it's great. Okay, next question: night owl or early bird?
Early bird for sure. Yep.
Yeah,
The older I get, the more 9 o'clock is 9 o'clock.
I hear you.
Yep.
I hear you. I know. Me too. I never knew I liked mornings so much.
Right. Yes.
All right. Are you a dog or a cat person?
Let's see. Dog.
Do you have?
No.
No.
Well,
Okay.
we have fish.
Oh, okay. All right.
But
You're
if I had
harder
to pick,
pet.
if I had to pick dog or cat, though, it'd be dog.
You'd pick dog. All right. Very good. Did you have one as a kid?
Yeah, we did.
Yeah.
Yep.
Yeah.
His name was Callaway.
Oh, nice. What kind of dog was it?
Oh man, he was I think he was mixed with quite a bit.
Yeah, just one of those.
Yeah, but he was black and white, kind of like the Callaway golf clubs. So
Oh, okay.
yeah, my dad was a big golfer. So
Oh, okay.
Mm.
All right. Neat. If you were going to have a piece of chocolate, would you choose dark or would you choose milk?
Trick question. I'm not a fan of any chocolate.
Oh,
No.
okay.
Mhm.
All right. Do you have a sweet tooth at all?
No, I'm strange like that.
Well, that's good for you,
I
Right.
guess
Keep the sugar down. What is your favorite color?
red.
Okay, very good. And your favorite word or phrase? That's kind of a tough one to think about.
Favorite
Yeah.
word or phrase? Let's see. I like the phrase, don't worry about the mission, not the commission.
Okay, I like that. I like that. Very good. That's a good one. That would be good in real estate too.
Oh, yeah.
You know? And your favorite movie?
Let's see. Batman.
Batman. All right, all of them. You like the
Yes.
series?
Yeah, the
Yeah.
Dark Knight series.
Okay, gotcha. Your favorite song?
Oh man, that's a hard one.
Is a hard one, right? Because you think of so many of them,
Yeah, let's see, man. Anything right now, nowadays, anything by Morgan Wallen.
Okay.
Yep.
All right, very good. And what about, this is an easy one. What about your favorite vacation spot?
Oh man, I love anywhere in Florida,
Mhm.
but also, you know what, Michigan. Anytime that it's not snowing.
Yeah.
Yep.
I hear you. All right. And your favorite mobile app?
Oh man, Facebook. Oh, yep. Facebook gets me every time.
Oh, I know, right? Right. All right. Well, very good. Well, those were our rapid fire questions. So it gave us a chance to get to know you a little bit better. But back to insurance. So I wanted to know there's so many. You go online and you can just get really bombarded with a lot. Is there a good way or any red flags where you can tell a plan that is just too good to be true?
Let's see. Yes. So especially with Medicare, there's a lot of commercials out there, especially this time of year. I'm sure you've seen all the the Joe Namath and different things on TV.
Right.
So they make it seem like there's just this one big plan out there that's going to get seniors all these extra benefits, and it's just one size fits all. When there's really no such thing. It's every plan is different for every person, and that's why it's good to sit down with somebody and compare your doctors, your medicines, and all that. So don't necessarily believe all you see on TV. Or those $0 health plan signs out there,
Right.
which those do exist, but they're not for everybody. So,
So it sounds like it's definitely beneficial to sit down with a professional to talk about your options rather than just get lost, in all the internet and,
yeah,
trying to figure that out.
Yep.
Because I know there's a lot out there.
yeah, and health insurance is always changing, especially with the Affordable Care Act.
Mhm.
A lot of people, speaking of those $0 plans, a lot of people don't know that those exist, even with all the yard signs around town. But they do. The way that the government's working in healthcare right now, it goes based off your household size and your income. So a lot of people, especially in the service industry that are working for tips, they get on a quality health plan
Mhm.
for a lot of times less than $50 a month, sometimes even $0 a month, and it's good insurance. And people just don't know that it's out there.
I think that's the problem. People just don't know, or they figure it's going to be so expensive. I can't afford it anyway. And they don't even
Right.
try,
Yep.
So, if anything, a great message today is, contact yourself, contact somebody, and see what you can afford and what you can get out there, especially if you don't have any health insurance right now,
Right.
because it can be affordable.
Yes,
you know?
absolutely.
Yeah, absolutely. Good. So, so as a member of GBN, in your words, why is it important to network with a referral organization such as GBN?
Tracy, have you heard the expression work smart, not hard?
Yeah.
So, my first year in the business, I was, out there hitting the pavement every day, grinding, which I believe a good work ethic is important, and you should be out there hitting the pavement. But when I found GBN after my first year, business got a lot easier. I wish I would have thought about networking and working off referrals in the beginning, but it's just been, the referrals that have been passed to me by people in my chapter. Feels good for myself to be able to give referrals to people, or somebody comes to me and they ask, hey, do you know somebody that does this? I always enjoy being able to say, I do. I have a great guy that I know, love, and trust. Here's his information.
And that's what GBN is based on, friends first and business second,
right.
And it really is a model that I think is working well, for our members.
Speaking of GBN, I would say, wish I would have thought about this before, but GBN is also a favorite mobile app of mine.
Yeah. It is, right. Me too. We do have a good app. That's actually true statement. We have a great app,
It's
you
great.
know,
It
and
gets better and better all the time.
it does, and it makes it easy for us to pass business to just find somebody. My husband actually needed someone to do tile at the resort where he manages, and we didn't have anyone in our particular chapter, so I went to the app.
Yeah.
And I found someone to do it for him, and now they're got the job and they're doing it.
Nice.
So yeah, GBN definitely works.
That's great.
GBN rocks.
That's right.
Okay. Well, we look forward to next week as well, when we'll be welcoming Tracy Carr. And thank you so much for joining us today. And if you have any questions again for Mike, you can get them into the comments right now, or feel free to just give him a call at 843-999-6226.
Yes, ma'am.
All right. And he'll be happy to answer any of your questions. And I'm sure there's plenty of questions out there. So, because insurance tends to bring up a lot of questions.
Sure does. Yes.
All right. Well, thanks again, Mike. It was great having you here.
Thank you, Tracy.
All right.